He estimates that the number of people with diabetes will continue to grow and that as many as 1 in 5 people have diabetes but don't know it. I spoke with University of Iowa healthcare physician Dr. Katherin White about the warning signs and what you can do to prevent diabetes.
The classical signs would be signs that your blood sugar is running too high, which can cause you to pee out extra sugar. Your kidneys try to pee it out to bring down the blood sugar, and that makes you dehydrated. It makes you hungry because you lose a lot of calories from that sugar. So classically, people will come in with high levels of thirst, high levels of hunger, and urinating more often. So they're up at night to pee, or they're going more often during the day. Sometimes they'll tell us their vision is blurry because high blood sugars can also blur the vision. Some people end up hospitalized with a new diagnosis of diabetes because they have really high blood sugars that cause them to get severely dehydrated. I will tell you that the most common way that we pick up a new diagnosis of diabetes is with no symptoms. It's through screening that we do in the primary care clinic.
Okay. And once someone does have that diagnosis, what are some ways you can help people manage diabetes?
So we think about it as sort of two prongs of the management of diabetes. We think about lifestyle change. So diet, we think about trying to eat a consistent amount of carbohydrates, which is the part of our diet that raises the blood sugar the most. So trying to keep the carbohydrates consistent over the course of the day in each meal, and also having meal times be consistent, because then your body doesn't get surprised by a high load of carbohydrates that can spike the blood sugar. Exercise is very important. So getting 150 minutes of exercise per week in terms of like cardio, like brisk walking, as well as some strength training. And then the goal is to try to lose a little bit of weight. For a lot of people who have type 2 diabetes, who their weight may be impacting their metabolic health, then weight loss can help lower their blood sugars. And for people who those approaches are not getting their blood sugars to goal, we have medications. A number of different classes of medications. We have things like metformin, which is the one we start with. It helps increase your body's sensitivity to the insulin that you're already making and lower your blood sugars. So that is the first medication we use for almost everybody with type 2 diabetes. And then other medications that we've all heard of if you have access to the internet. Things like semaglutide or Ozempic is a very commonly used diabetes medication that works really well to help lower blood sugar. Empagliflozin or SGLT2 inhibitors is another one that we use commonly. And ultimately, if you work through the sort of oral medications and other diabetes medications that we have, you may end up needing insulin shots, because if your body can't make enough to keep your blood sugar down, even with the support of these medications, then insulin is what you need.